2019, UK HealthCare in Lexington, Kentucky launched a value-based Medicaid-directed payment program focusing on the state's toughest health challenges, including cancer, heart disease, obesity, behavioral health, and substance use disorders.
We at UK had struggled for many years on trying to get enough momentum behind our quality program. And this served as a catalyst because putting 20% of our payments at risk was a sufficient risk that it changed everyone's incentives to focus on how do we improve the quality of care and how do we open up access to care for the Medicaid population.
The program focused on 14 quality measures, including cancer screening, readmissions, well child visits, use of high-dose opioids, tobacco, body mass index screening and follow-up, blood pressure, hemoglobin A1C control, and depression screening.
We had a lady who was behind in getting her mammogram screenings. She was had a patient appointment, and because of the new culture, the provider encouraged her to get the mammogram that she was delinquent on while she was there that day. And that came about as part of that screening tool. That day, she learned she had early stage breast cancer. But by catching it early in the process, we were able to ensure a good patient outcome.
To facilitate that new culture, UK HealthCare appointed dyads of clinical leaders and administrators to lead quality initiatives. They included standard rooming protocols for nursing staff, standard workflows and orders to reduce documentation burdens, and performance dashboards to monitor improvement.
We've worked really hard on involving more frontline staff as we do the sprints and just hear their ideas and their thoughts and what will work or not work. So I think they just feel more comfortable coming to us with issues now.
From July 2019 to June 2022, UK HealthCare increased depression screening by 64 percentage points and well child visits for children ages 3 to 6 by 45 percentage points. The health system also increased blood pressure control and breast and colorectal cancer screening rates. It decreased readmission rates, high-dose opioid use, and uncontrolled HbA1c rates for patients with diabetes.
Before we started this program, we would come up with an idea to change something with operations, and clinic staff would be very worried or nervous that this would be a big change. Now having that structure, they see the plan laid out, and we'll see that we'll evaluate it and we can go back to the way things were before. So it feels safer to try these new experiences.